Okay, so let's talk a little bit about the pathophysiology of cancer. First of all, you need to understand how normal cells operate. Okay, normal cells have a specific morphology. So lung cells look like lung cells, blood cells look like blood cells, etc. So they have a specific form and shape that's geared toward a specific function. So each cell has a specific shape and a specific function. They have a smaller nucleus in relation to the cytoplasm. So if you look at the cells on a microscope, you can see the nucleus, but it's smaller in relation to the cytoplasm. They typically have tight adherence. So most normal cells stick together with other cells of the same type. Now, blood cells are an exception because they have to travel. But when you look at a section of the lung or the skin, the cells have tight adherence. They stick together. And they don't typically get up and go wandering around. They're non-migratory. They stay where they belong, okay, except for blood cells. They also have orderly and regulated growth. Now, benign tumors, so a tumor is extra growth of some tissue. It's a solid lesion. Benign tumors have a specific morphology and specific function. So one example of those is a lipoma. It's those cells in a lipoma are still fat cells. They still look and behave like fat cells. They still have a smaller nucleus in relation to the cytoplasm. They have tight adherence. They don't migrate. They have orderly growth. They overgrow by hyperplasia. They make too many cells, but they don't invade other tissues. And most benign tumors actually have normal chromosomes. Okay, now cancer cells lose their morphology. That means they don't have this, they lose the specific form and shape. And that can happen over a few generations of cell division. That's called anaplasia. They've lost their specific morphology. They also lose their specific function either partially or completely, and they don't serve a useful purpose. Cancer cells serve no useful purpose. They have a larger nucleus in relation to the cytoplasm. So it's like their purpose is dividing and making more. They have very loose adherence, so they're more likely to have cells break off from the mass. And they migrate through the body. So cells can break off from that mass, get into the bloodstream, migrate somewhere else, and set up shop and start dividing there. That's what causes metastasis. So normal cells, there's something called contact inhibition. Close contact with other cells and other types of tissue actually inhibits cell division. That is one of the things that regulates growth of those tissues. Cancer cells lose that contact inhibition, so they just keep dividing and dividing and dividing, even when they run out of space. They also may not respond to signals for apoptosis, which is when cells self-destruct. They invade other tissues, and they commonly have abnormal chromosomes. So I want you to make a chart and compare those things. Okay, so that you understand what are the differences. Is this a cancer cell? Is this a benign tumor? Is this a normal cell? Okay, what are the differences? Now, the development of cancer requires it kind of happens in stages. And first is the initiation. There's some change in the gene expression in some cells. And if growth conditions are right, that cancer will spread. So that initiation can happen pretty frequently, but our bodies can stop that. So initiation is the very beginning. Cells divide, and we have some abnormal gene expression that is creating a cancer cell. Okay. Promotion is once that cell is initiated, once we have a cancer cell, there are substances that may promote further replication. One example of that is estrogen sensitive breast cancers. Okay. Progression means that the cancer becomes more malignant over time. So we have a normal cell, it divides. Normal cells, they divide. One of them maybe divides, and we've got abnormal cell here. Okay. And there might be substances that cause it to divide faster. But once we have that, there might be substances that kill off the abnormal cell, because our immune system also helps with that. But once that cell is initiated and it begins to divide, each generation of new cancer cells becomes more malignant. They get sicker and sicker and sicker. Okay. The primary tumor is always identified by the parent tissue. So when we talk about cancer, we talk about where the primary tumor is. Secondary tumor or metastasis, when cells break off from that cancer, they can get into the bloodstream or the lymphatic system, and they end up somewhere else. They grow in other organs or tissues. Metastatic cancer is identified by the parent tissue and location. So an example of that would be if a patient has breast cancer and some of it breaks off and gets to the bone somewhere, which often that's in the spine, and begins setting up cancer there, that patient has breast cancer that has metastasized to bone. Okay. All right. In the next section, we'll talk about different types of cancer treatments. This is a really, really shallow overview, a shallow look at cancer. Next year, you dig a lot deeper. Okay.